The job description of a nutritionist centers on promoting health and wellness through diet and nutrition strategies tailored to individuals' specific needs. Nutritionists are experts in food science who assess dietary habits, evaluate nutritional deficiencies, and develop plans to improve overall well-being through balanced eating. They work in a wide range of environments including hospitals, clinics, fitness centers, schools, public health organizations, private practices, and research institutions. Their ultimate goal is to help individuals make healthier food choices and maintain lifestyles that prevent or manage disease. A nutritionist's role is both preventive and therapeutic. They not only assist people in making smart food decisions to avoid future health issues, but also play a major role in managing conditions such as diabetes, obesity, hypertension, and gastrointestinal disorders. By educating clients on the importance of vitamins, minerals, macronutrients, and hydration, nutritionists help improve health outcomes and enhance quality of life. The job description of a nutritionist also involves assessing dietary patterns, conducting consultations, analyzing food intake logs, and recommending meal plans. This requires them to have a deep understanding of human metabolism, nutritional biochemistry, and the relationship between diet and disease. They must be able to interpret laboratory data, medical histories, and physical activity levels to develop effective nutritional guidelines for each client. Client assessment and dietary planning. One of the key responsibilities of a nutritionist is to conduct detailed assessments of clients' dietary habits, health history, and lifestyle factors. This often begins with one-on-one interviews where clients describe their eating behaviors, physical symptoms, and medical concerns. Using this information, nutritionists identify imbalances or deficiencies and develop customized nutrition plans that align with the client's goals, whether it be weight loss, muscle gain, managing chronic disease, or improving energy levels. Nutritionists provide meal planning services, which include suggesting nutritious recipes, appropriate portion sizes, and timing of meals and snacks. They take into consideration dietary restrictions such as food allergies, intolerances, cultural preferences, and ethical choices like vegetarianism or veganism. The ability to personalize dietary advice based on individual needs is a critical skill in this role. They also monitor the client's progress over time, adjusting dietary recommendations based on results and feedback. In some cases, nutritionists collaborate with other healthcare professionals such as physicians, nurses, physical therapists, and psychologists to ensure a multidisciplinary approach to patient care. Midway through the job description of a nutritionist, it becomes evident that education and communication are core components of the role. Nutritionists spend a significant portion of their time educating individuals or groups about healthy eating habits, nutritional labels, food safety, and cooking techniques. In schools or corporate wellness programs, they may deliver workshops or seminars aimed at raising awareness about proper nutrition and lifestyle choices. Research, documentation, and public health. In clinical or research settings, nutritionists analyze scientific data, study emerging dietary trends, and evaluate the impact of food components on health. They may conduct nutrition-related research, contribute to scholarly articles, or assist in the development of public health policies. Their findings can influence guidelines on dietary supplements, fortified foods, or school lunch programs. Nutritionists are also responsible for maintaining accurate and confidential records of their clients' dietary histories, assessment results, meal plans, and follow-up outcomes. This documentation not only supports continuity of care but also meets ethical and legal standards in healthcare and wellness industries. In community health environments, nutritionists work to improve the nutritional status of population groups. They may design public campaigns to combat malnutrition, promote breastfeeding, reduce sugar intake, or address obesity. Their efforts play a critical role in addressing public health challenges through preventive strategies that emphasize food and nutrition. Skills and qualifications required. To excel as a nutritionist, a strong foundation in biology, chemistry, and physiology is essential. A bachelor's degree in nutrition, dietetics, or a related field is typically required, though some roles may demand a master's degree or certification from a professional body. Licensing or registration may be necessary depending on local regulations, especially for those working in clinical or therapeutic roles. Communication skills are fundamental. Nutritionists must be able to explain complex scientific concepts in simple, relatable terms. Whether working one-on-one or speaking to large groups, the ability to convey the importance of good nutrition in a clear and compassionate manner is vital. Good listening skills also help in understanding client concerns and crafting effective recommendations. Analytical skills are needed to interpret lab reports, assess dietary records, and apply scientific research to practical settings. Problem solving is frequently required when creating realistic meal plans that suit a client's health conditions, taste preferences, and budget. Interpersonal skills, patience, and empathy contribute to building trust with clients who may be struggling with long-standing health issues or emotional relationships with food. A good nutritionist supports clients without judgment, fostering motivation and accountability throughout the journey. Time management and organizational skills are also important, particularly when handling a high volume of clients, coordinating educational events, or managing research responsibilities. In private practice, business acumen and marketing knowledge are additional assets for growing a client base and building a reputable brand. Work environment and career outlook. Nutritionists work in diverse environments including hospitals, nursing homes, outpatient clinics, gyms, universities, corporate wellness programs, government agencies, and food industry companies. Their schedules may include both routine appointments and urgent consultations, depending on the setting. In private practice or consultancy roles, nutritionists often have flexible hours and manage their own schedules. However, they may also work evenings or weekends to accommodate clients. In public institutions, the work is generally structured during regular business hours. With rising public interest in health, wellness, and disease prevention, the demand for nutritionists continues to grow. Increased awareness of the role of diet in mental health, athletic performance, and chronic disease management means that nutritionists are in high demand across sectors. They may specialize in areas such as sports nutrition, pediatric nutrition, geriatric nutrition, or functional nutrition, depending on their interests and training. Conclusion: the job description of a nutritionist emphasizes a role that blends science, education, and compassion to promote healthier lives through food. From assessing individual needs and developing meal plans to conducting public health campaigns and staying updated with scientific advancements, nutritionists perform a wide array of tasks that impact physical and mental well-being. Their work is grounded in evidence-based practice and driven by the goal of making nutritious eating accessible, enjoyable, and sustainable for everyone. With strong communication skills, empathy, and a passion for health, nutritionists have the potential to make a lasting difference in the lives of individuals and communities alike.